Welcome to the video on formulation development for BCS Class III drugs. We know regarding the BCS classification for the drug molecules. BCS classification is based onto the solubility and the permeability, and permeability is mainly from the GI. Various technologies are adopted for formulating the different BCS class molecules. BCS class 1, 2, 3 and 4 are there. 4 BCS classes are there. And as per these BCS class, there is a change or there is a difference in the solubility and permeability. Many of the professionals know this very well. Still, once again, I want to introduce for the BCS classification. For BCS class 1, solubility is high and permeability is also high. BCS class 2 molecules are low soluble and high permeable. BCS class 3 molecules are high soluble and low permeable. BCS class 4 molecules are low soluble and low permeable. Always we know that we need to improve the solubility of insoluble compounds to improve the dissolution, absorption and bioavailability. Mainly for BCS class 2 and 4, the solubility improvement techniques are used. I have made a video on this solubility and bioavailability improvement for BCS class 2 and 4 drugs, and this video is only for BCS class 3. Because solubility is not a problem for BCS class 3 molecules, but the permeability is. BCS class 3 drugs are having high solubility, but permeability is low. That's why these molecules have less bioavailability. The primary challenge in the BCS class 3 formulation is enhancement of the permeability. And if permeability is improved, the bioavailability can be improved. Various formulation approaches can be tried, can be used based on to the drug dose and the dosage form requirement. Also, the formulation approaches are dependent on to the indication of the BCS class 3 molecule. So, for BCS class 3 drugs, overcoming the permeability barriers requires a combination of different formulation strategies to improve the permeability, and that's why improving the bioavailability. If you can get success in improving the permeability, it will improve the bioavailability. Then at that time for some of the molecules you can decrease the dose also, and it will lead to improvement of the safety. Many techniques are there. We will see for the formulation development of BCS class 3 molecules. Considering the oral formulations, as the permeability is the problem, enhancing the permeability to improve bioavailability is the primary approach. Oral solid formulations can be developed with BCS class 3 drugs by using different permeation enhancers. You can use some surfactants, bile salts, and some specific excipients which can improve the permeability through the GI tract. So permeation enhancers can be used. You can make the prodrugs which are more permeable than the parent drug, and that's why prodrugs can improve the bioavailability. Complexation can be made with some excipients. Example is cyclodextrin. Ion pairing techniques may be used to improve the transport across biological membranes. Gastroretentive systems can be made so that the residence of the formulation is improved or prolonged in the gastric region, and that's why absorption can be improved in the upper GI tract. Considering the oral liquid formulations, lipid based carriers can be used, lipid based systems can be used to emulsify, to make the microemulsions, and that's why enhancing the permeability. Self-emulsifying drug delivery systems can be developed. pH modulation can be done for adjusting the formulation pH, which will ensure the drug remains in the optimal form for better absorption. If you want to develop injectable formulations or parenteral formulations, nanotechnology can be used, liposome science can be used, and permeation enhancers can be used for BCS class 3 drugs. Topical and transdermal systems can be made with some permeation enhancers like alcohols, fatty acids, which can improve the permeation. Nanoparticles and liposomes can be prepared to improve the penetration across the skin. Ionophorosis, electroporation can be tried, can be applied to improve the permeability and to increase the absorption through the dermal application and dermal penetration. Inhalation dosage forms can be formulated with some surfactant use to improve the permeability across or through pulmonary tissues. Micronization technique can be used to increase the absorption or deposition by reducing the particle size. Lipid-based carriers can be used to improve the pulmonary absorption. These are some of the technologies you can adopt or you can try or you can research for formulation development of BCS class 3 drugs. Ever you have thought regarding why the BCS class 3 drugs have less permeability? What is the reason behind having less permeability? So some reasons are there like molecular weight of the drug. Also some drugs have more hydrophilic nature and less lipophilic nature. That's why these drugs get solubilized. But these drugs cannot get partitioned through the lipid membrane or lipid membrane of the GI. So these have the less permeation. Sometimes efflux mechanism may be there. Sometimes some transport saturation may be there. And these things lead to less permeation and less bioavailability for the BCS class 3 drugs. Always remember, drug should have some lipid loving nature also along with the hydrophilic nature. It is not like that if the drug is soluble in the water or throughout the GI pH range, then it will have good absorption. It is not like that. Some drugs have higher molecular weight, some drugs have charge. Some drugs cannot get partitioned through the lipid membrane. That's why they remain in the in the fluid or water of the GI fluid, and that's why it doesn't get permeated. The BCS class 1 drug are opposite to, you can say, to BCS class 3 drugs. The BCS 1 drugs have high solubility and high permeability. So considering the BCS classification, BCS 3 drugs are little bit more tricky to develop or formulate into the formulation because these are having the high solubility but the less permeability, and it is very difficult to work on the permeability compared to the solubility. So I hope this video will help you to have some good idea about this BCS class 3 drug formulation development, and I hope you will like this video. I request you to please do like, share and subscribe to this channel. Share these videos to your friends and colleagues. Thank you for watching the video.